Welcome to Angel Health Academy. Topic for the day or topic for the session is nursing standards or setting standards for nursing practice. First, let us discuss about what you mean by standard. Standard is a predetermined baseline condition or level of excellence that consists a model, a structural framework to be followed and practiced by the professionals. So standard is a predetermined. It determined before we do or render the services. So it is a predetermined baseline condition. Okay, a basic for doing some things, a basis for doing something, or the level of excellence, the maximum performance. The level of excellence that consists a model. It is a model. It is a theoretical model, or it is a theory, or it is a structural framework to be followed, to be continued and practiced when we render the services. For example, when we do the patient care. Thus, standard is a benchmark of achievement. So, the maximum achievement a person can do, an organization can do, that is called a benchmark. So, standard considered as a benchmark of highest achievement or maximum achievement, which may serve as the basis for comparison or basis of comparisons. So, this standard we use as a benchmark to comparison the services or activities rendered by another person's to evaluate the excellence of his services or his activities. The standard is a model, or it is a predetermined baseline condition, or it is a benchmark of maximum achievement or achievement which serve or which is used as the basis for the comparison of the activities of a person to evaluate whether he is achieved the maximum level, that is excellence, or not. Now let us talk about nursing standards. Nursing standards are authoritative statement. Okay, the statement, it is a descriptive statement. Okay, that is given by the authority. Okay, authoritative or authorized agency. So nursing standards are authoritative statements that describe, that explain the level of care. Okay, level of nursing care and performance expected from the nurses or from all the nurses in the delivery of high quality patient centered services, safe and ethical based care services to the patient. Okay, so nursing standards are authoritative statement that describe, that explains, that tells about the level of care to be given to the patient or could be given to the patient, and the performance expected by the accredited agency or the organization from the nurses in the hospital, or the performance expected from the nurses, okay, in the delivery of high quality, comprehensive, patient-centered health care or nursing care, safe nursing care that is concerned with the safety of the patients and in relation to ethical concern, that is ethical care or ethical based nursing care. These standards, okay, nursing standards provide a framework, a foundation for professional practice of the nurses, which guide the nurses in their daily work in the hospital, okay, or in the routine work in the ward during the shift, and serve as a benchmark, okay, to give excellence of the services, and serve as a benchmark for evaluating the nursing care of the nurses, whether they are fulfilling the excellence of the nursing services, whether they are rendering the maximum quality assurance nursing care or not, okay, in the clinical setting. So it acts as a benchmark for evaluating the nursing care of the nurses. Thus, they are typically developed by the professional nursing organizations. So the standards or nursing standards are made by, or that is prepared by, or that is developed by the professional nursing organizations. Okay, so they are typically developed by the professional nursing organizations. So internationally we have International Council of Nurses, ICN, okay, and ANA, American Nurse Associations. Then the regulatory bodies such as Indian Nursing Councils, State Nursing Councils, etc. Okay, regulatory bodies, and even it can be developed by the healthcare institution itself for themselves. Okay, healthcare institution means a healthcare agency, hospitals. Okay, they can set their own policy and their own nursing standards that has to be obeyed by the nurses who works in the particular hospital, okay, or healthcare agency. Now let us see the definition of nursing standard. Nursing standards are guidelines and criteria. Already we said it is a predetermined baseline criteria. So as it guides, it is a guidelines and it is a predetermined criteria that outline or that tells about the expected level of performance and behavior of the nurses, okay, to ensure the high quality patient care, okay, quality assurance in rendering the patient care, high quality patient care, safe patient care and ethical based patient care. So the definition of nursing standards are, it is a guidelines and set criteria that outlines, that determines the expected level of performance and behavior of the nurses who function in the different nursing departments or nursing units to provide, to ensure, to make sure high quality, safe and ethical based or concerned nursing care to the patients, or in short, patient care in the hospital. Now let us discuss about the characteristics of nursing standards. What are the different features of nursing standards? First one is, it is predetermined. Nursing standards are predetermined by the professional organization or accreditation body. Okay. Then second characteristics or feature is, it is established or developed by the health authority. Okay. As we are already mentioned, either by the professional organization or by the healthcare agency or health setting or healthcare institutions, hospitals, health centers, etc. Okay. Third feature is, it has to be communicated to and accepted by the individuals affected by the standards. For example, nursing standards, it has to be communicated well in advance to the nurses, okay, and even the patients. Both parties should know that what you mean by nursing standards, how it could achieve, okay. So it has to be communicated to and accepted by the individuals who are affected by these standards, okay. So of course there should be a good awareness about the nursing standards both by the nurses and the patients in the hospital. Then fourth feature is, it must be realistic. It must be real, okay, and it must be acceptable by the patients and the nurses. So realistic, acceptable, and it must be measurable. We have to measure whether it is maximum excellence is achieved or not, that, okay, whether the nursing standards are achieved or not. Measurable, and it must be achievable. We have to achieve in the healthcare settings. Then fifth one is others. That includes, it must be a measurement tool. Of course, nursing standard is a measurement tool to achieve the quality assurance, or it is used in nursing audit, okay. I have already uploaded a video about the nursing audit, okay. So nursing standard is a tool which is used in the nursing audit, okay. So it is a measurement tool, okay. One feature is, it is a measurement tool. Other feature is, it must be based on the current knowledge on scientific practice in relation to the nursing, okay. It should be based on the, or it must be based on the current knowledge of the nursing or current knowledge on the scientific practice or evidence based practice in the nursing or nursing procedures. And last one is, third one is, it must be reviewed and revised periodically, okay. As it has to, or it must be based on the current knowledge, we have to periodically, it must be reviewed and modified, okay, and made maximum excellence level to give the care to the patients. So these are the 5 characteristics of the, or features of the nursing standard. Now let us see what are the purposes of nursing standards. Purpose of nursing standards. First one is, it guides the practices of the nurses in the clinical setting. So as it is a guideline, it provides the guidance to the nurses to render the maximum quality assurance care or maximum excellent nursing care. Second purpose is, it must be ensure or make sure quality nursing care, okay, excellent patient-centered nursing care services. That is, ensure quality nursing care. Third purpose is to promote the patient safety. Of course, we have to safeguard the patients, okay, in the hospital settings. So nursing standards promote the patient safety in the hospital settings while rendering various nursing procedures and other nursing related activities. Then fourth one is it support the professional accountability. Of course, as the nursing standards periodically revise, okay, the nurses will get more advanced knowledge, okay, thus they are accountable to or answerable to their services in the hospital settings. Thus it support professional accountability for all the nurses in the hospital. Then they render the maximum excellence of quality based or patient centered nursing care. And fifth one is it facilitates the continuous improvement. As the nursing standards periodically revise or update based on the evidence based practice, indirectly it enhances the knowledge, attitude, skill or competency of the nurses. Thus, it facilitates the continuous improvement of the nurses to render the excellent nursing care services based on the nursing standards and professional standards. At the same time, nurses can uphold the nursing standards and professional standards. And last one is others. Sixth one is others, which includes it provide the nursing standards provide a base for evaluating the quality nursing care in the hospital settings. Okay, so it provides the basis or base for evaluating or checking the quality of the nursing care rendered by the nurses in the nursing care unit, wards, departments of the hospital. Then second is it helps in determine the degree of standards. Okay, how much the nursing standards is attaining in the nursing unit or nursing ward. Okay, to determine the degree of nursing standards maintained by the nurses or nursing staffs in the different wards of the hospital. Then it also helps to determine the nursing negligence or malpractices occur in the hospital settings or in the nursing care ward or nursing care unit. I have already uploaded a video that is difference between negligence and malpractice. Okay, if you are interested, you can watch that. Okay, that will be a questions comes like a differentiate between malpractice and negligence. So one of the other purposes to determine the nursing negligence occur in the nursing departments. The last purpose is to decrease the cost of the nursing care or wastage of the money in relation to nursing care practices. Okay, that is it decrease the cost of the nursing care. So these are the important 6 purposes of nursing standards. The next session is key elements, aspects or components of nursing standards. There are 5 important elements or components or aspects of nursing standards. First one is competency based. Nursing standards is competency based. Second one is patient centered. Okay. Third one is evidence based. Fourth one is culturally competent. And last one is safety oriented. So these are the important elements. Let us see what is the meaning of these elements or components of nursing standards. First element is competency based. Nursing standards are designed or developed or planned to ensure, to make sure that nurses possess, okay, have necessary skills, knowledge and judgment, decision making power to perform their duties in the ward. So competency based is nothing but it improve the or enhance the competency of the nursing staff. Thus nursing standards are designed to ensure that nurses possess the necessary needed skills in the nursing practice in relation to nursing practice and the knowledge or competency in relation to nursing subject and judgment, management and leadership quality to take decision in the emergency situations or wherever it is necessary to perform their duties efficiently and effectively in the nursing department. Second element is patient centered. Nursing standards emphasize, it gives importance to the or it gives more values, okay, the importance of delivering care that is respectful of, okay, and responsive to the individual patient preference, needs, likes and their values. Okay, we respect the patient in rendering patient health care services or nursing care services based on their needs, values and based on their preference. So that is patient centered. So nursing standards emphasize the importance of delivering or rendering or serving the care that is respectful of, with respect, with due respect and responsive to or responsible to individual patient preference, okay, or likes and their needs, individual needs and their values as a human being. The third component is evidence-based. Of course, nursing standards are grounded or based on the latest research, okay, clinical or nursing research, and best practices, okay, to promote the effective care and improvement of the patient outcomes, okay, maximum excellence of rendering nursing care. Thus, nursing standards are grounded in the latest research, or it is based on the latest research evidence, and it render the best nursing care, that is excellent nursing care, that is best practices to promote the effective and efficient patient care, patient-centered care, thus to improve the patient outcomes, safety and recovery. Then fourth element is culturally competent, okay. They recognize, nursing standards recognize the importance of the cultural values and cultural awareness and sensitivity of the patients in delivering care to the different type of population, okay, or the patients. So patients comes from different community, they have different cultural and traditional practices that has to be kept in mind to render the services or deliver the nursing care services. So nursing standards, of course, it enhance or it recognize the cultural background of the patient, the cultural practice and beliefs of the patient. Thus, they recognize the importance of cultural awareness and sensitivity in delivering the patient care to the diverse or different type of population as patients in the ward. The last one is safety oriented. Okay, of course, it promote the or it ensure or make sure the safety of the patient in the hospital setting. Thus, many standards of the nursing focus on reducing the errors, for example, medication error, okay, promoting infection control in the ward to prevent the secondary infections and ensuring the total patient safety, okay, in the nursing station. So, safety oriented means the nursing standards focus on reducing the nursing related errors which occurs during the delivery of healthcare services, and moreover promoting the infection control, okay, or prevent the nosocomial infection in the hospital, and in total ensuring the patient safety in the hospital, early recovery and the complete satisfaction of the patient. So these are the 5 important elements or components of nursing standards. Then sixth one is sources of nursing care standards or nursing standards. So there are different sources of nursing care standards. So first one is international healthcare agencies and even professional organizations, nursing organizations, professional organization. Second one is licensing bodies in nursing, okay, like Indian Nursing Council, State Nursing Council, that is the licensing body of the nursing. Then institutions or healthcare agencies themselves could develop various nursing standards according to their excellency and according to their benchmark. Then department of that particular hospital or institutions, okay, so different departments can make different nursing standards according to their excellence, okay. Then government unit, central, state and even local government sectors also can develop the nursing standards, and others, okay, there are different other sources. That is, nursing care standard can be established, developed, reviewed and enforced, okay, by the various sources such as international agency or professional organizations, okay. International health agency, you know that is WHO, World Health Organization. Then professional organizations such as ANA, American Nurses Association. Even professional organization in India, we have Trained Nurses Association of India. Even international agency includes International Council of Nurses, okay. Then licensing bodies include INC, that is Indian Nursing Council, and KNMC, okay, Kerala Nursing and Midwifery Councils, or all the state nursing councils, okay, they can develop the nursing standards to enhance the quality of the nursing care in that particular, in their states, okay. Then institutions or healthcare agencies such as university, okay, and even healthcare university, hospital, health centers, okay, health clinics and health centers, etc., okay, can develop the nursing standards. Then department of the particular institutions, specific patient unit, okay, ICU department, coronary care unit department, okay, oncological department, like then they can make their own nursing standards. Then government units such as national government organizations, state level organizations and even local level units can set the nursing standards, and others, even patient care unit itself can make nursing standards. So these are the different sources of developing, reviewing and enforcing the nursing standards in India, both the international level and national level. The next session, one of the important session, is categories or types of nursing standards. categories or types of nursing standards. Nursing standards can be broadly divided or classified into 4 categories. Okay, one is professional practice standards. Second area is clinical care standards. Third one is ethical standards, and fourth one is legal standards. So nursing standards can be broadly divided into 4 different categories according to the areas of services. Okay, first one is professional practice standards. Okay, that is related to professionalism. Okay, professional practice. Second one is clinical care standards according to nursing care aspects. Okay, patient care, that is clinical care standards. Then related to ethical concern, that is ethical standards, and related to law, it is legal standards. So these are the 4 important types or categories of nursing standards. The first category of nursing standards is professional practice standards. These outline the responsibility and accountabilities of the nurses in the context of patient care. It explains or determines the various responsibilities of the nurses, roles and responsibilities, and accountabilities. Okay, answerable in different conditions or answerable to the patient care. Okay, of the nurses in the context in relation to patient care. Okay, or nursing care services in the ward or nursing unit. Professional practice standards focus, it gives importance on clinical area, ethical concept and legal aspect. Okay, law and order, legal aspects of the nursing practice. So it focuses on clinical, ethical and legal aspects of the nursing practice in the nursing unit or in the department of the hospital. Professional standards typically include competency, accountability, collaboration, communication and advocacy. So the professional nursing standards includes first one is competency of the nurses. Okay, accountability of the nurses. Okay, collaboration with other health related sectors or departments, communication process and advocacy in maintaining the right of the patients. First one is competency. Competency means the nurse must demonstrate, okay, show the necessary knowledge, skills and judgment to provide safe and effective nursing care or patient care. Okay, competency is nothing but that is the knowledge, skill and judgment or decision making with a positive attitude. Okay, so all the nurses must demonstrate or show the necessary needed knowledge, okay, updated knowledge to render the health services, maximum skills, excellency in skills to render the nursing care services and judgment, logical decision making in various situations. Okay, all this to provide the safe patient care and effective and comprehensive patient-centered care to the patients in the ward or in the nurses unit. Okay, that is about competency. Second one is accountability. Okay, nurses are responsible for their actions, whatever procedure, whatever nursing care. Okay, all those activities, roles and functions, the nurses are answerable and accountable. Okay, and all the decisions she makes in the patient care. Okay, with the nursing care process, all are responsible, answerable and accountable by the nurses. Okay, that is about accountability. Nurses are responsible for their all the actions in relation to patient care and all the decisions they are taken in relation to patient care. Third aspect is collaboration. Okay, nurses must work effectively with other healthcare professionals. So it is the team nursing. Okay, there are many nurses. Okay, so nursing care team. So she has to work collaboratively and effectively with all other healthcare professionals with various departments and with the patients and their families. Okay, in the ward to ensure the best outcomes of the nursing care services or patient care services. So that is about collaboration. Nurse must work effectively, efficiently with the other healthcare professionals or her team members. Okay, healthcare team members and with the patients and their families to ensure the maximum benefit of the healthcare services or patient care services. Then fourth aspect is communication. Nurse should engage clear, compassionate or passionate and effective IPR, interpersonal relationship or rapport, that is communication with the patients and her colleagues, team members, okay, health team members. So nurses should engage a clear, okay, without any confusion, okay, clear communication, compassionate, okay, with empathy and sympathy compassionate communication and effective communication whenever it is necessary and wherever it is necessary with the patients and colleagues to render the patient care services or throughout rendering the patient care services in the hospital setting. The last one is advocacy. Nurses must act as an advocate for the right of the patients. Okay, all the nurses must act as an advocate for the rights of the patient, that ensuring their rights. Okay, patient rights, their needs and their preference. Okay, based on their needs, based on their likes and preferences, and based on their right as an individual, we have to respect the patient and we have to render the services. So it is the nurse's responsibility to act as an advocate for the patients during a stay in the hospital. So these are the 5 aspects comes under professional standard practice. That is the first type of the nursing standards. The second category is clinical care standards. Second areas related to nursing care in the clinical setting, that is clinical care standards. These standards, these nursing standards are focused, okay, they are focused on patient care delivery or patient health care services or nursing care to the patient, ensuring that nursing care is evidence based practice. Okay, based on the evidence. Okay, based on the latest research result. Okay, in relation to patient care. Then patient centered, based on the need and preference of the patient, and aligned with the best practice, best course of action or best practices of various nursing procedures. Okay, so clinical care standards focused on the patient care delivery that ensures or makes sure nursing care is evidence based. Okay, based on the evidence, latest evidence or research evidence, and patient centered, and that is aligned, that follows the best practices or best course of practices with the nursing care plan and nursing care process. The clinical care standards includes or its elements are patient assessment, care planning, implementation of the care, evaluation of the care, and infection control. So these are the 5 different area or aspects of clinical care standards for clinical care nursing standards. That is patient assessment, care planning, implementation, evaluation, and infection control. First one is patient assignment. Here nurses are expected to conduct comprehensive assessment of all the patients. Okay, comprehensive assessment. It includes physical assessment, psychological assessment, and even social assessment or social aspects of the patient. Okay, so nurses are expected to conduct a comprehensive assessment of all the patients in her ward or unit. That is patient assessment. Second one is care planning. Nurses must create individualized care plans for all the patients with the different problems. So create individualized care plans that should reflect or based on the patient's real needs, okay, and preference, likes, etc. Okay, so nurse must create individualized nursing care plan for each patient that would be based on his needs and preferences. Then third one is implementation of the care, what is planned. Okay, nurses are responsible for delivering the care or implementing the care according to the best practice with the maximum effect. Okay, that should ensure that all the interventions are appropriate and effective according to the need and according to the problem of the patients. So that is regarding implementation of care. That is best practices with the highest skill, knowledge, and competency and positive attitude. Then fourth aspect is evaluation. Nurses must periodically and regularly evaluate the patient outcomes after the nursing procedures and adjust the care plans wherever is necessary and whenever it necessary. That is, adjust the care plan as needed to meet the patient's evolving conditions. Patient condition may vary, okay, problem may vary. According to that, care plan has to be adjusted. And last one is infection control. The last aspect is infection control. Nurses must adhere or follow all the infection prevention protocols, okay, that is given by the accrediting agency or as per the policy of the NABH or as per the policy of the healthcare institution. That is infection prevention protocol such as hand hygiene, okay, hand wash to minimize the risk of healthcare associated infection and nosocomial infections, other infections. Okay, so infection control is nothing but nurses must adhere. They have to strictly follow the infection prevention protocols in the nurses unit or in the ward or in the department, that include especially hand hygiene, that is to minimize the risk of health care or health team associated infections occur in the hospital. Then third type is category is ethical standards. These standards focus on the ethical responsibility of the nurses. As the term indicates, it is something related to ethics, which include patient confidentiality, maintaining the confidentiality of the patient information, then informed consent to render or to do any procedure, invasive or non-invasive, then advocacy, act as an advocate, and maintaining the patient dignity as an individual or a human with a human right. So these standards, ethical standards focus or based on the ethical responsibility of the nurses in the clinical setting, which include maintaining patient confidentiality, informed consent, advocacy, and maintaining patient dignity in the ward throughout his admission or stay in the hospital. Thus, ethical standards guide the nurses in making logical decisions that is aligned with the professional integrity, professional standard, and moral values. These include respect for autonomy, beneficence and non-maleficence, confidentiality, and justice. These all are the ethical principles. I have already uploaded a video about the ethical principles. If you would like to know more about that, you can go through that. Okay. First one is respect for autonomy. The nurses must respect the patient's right as an individual. Okay, every individual has a right according to the constitution. So patient's right to make a decision about their own care. Okay, patient has the right or freedom to make decision according to his treatment. That means involve the patient in the care plan, making care plan, implementation and evaluation of the programs. Second one is beneficence and non-maleficence. Nurses must act in the best interest of the patient, according to the interest of the patient, that is beneficence, for the welfare of the patient. And at the same time, avoid causing any harm through any procedures, that is comes non-maleficency. Okay, so providing best to the patient as benefit to the patient, that is beneficence, and avoid making any harm to the patient, that is avoid causing harm, that is non-maleficence. Then third one is confidentiality. Nurses are required to maintain patient confidentiality and safeguard the private health information or sensitive information. Unless it is required, it cannot be disclosed to any papers. Okay, if it is required only, it has to be disclosed to the health team members for the welfare of the patient and for the purpose of the treatment. Thus, nurses are required to maintain patient confidentiality about the patient information. Okay, and moreover, safeguard their private health information or sensitive information. The last one is justice. That is, nurses should ensure fair and equal treatment for all the patients admitted in that particular department without any discriminations about the sex, about education, about financial background or socio-economic background, etc. Okay, the justice, that means nurses should ensure the justice or fair and equal treatment, equitable distribution for all patients without any discrimination for rendering the nursing care services or patient care services in the hospital throughout his stay in the hospital. Then fourth category or last type is legal standards. Okay, legal standards. This refers to the laws and regulations related to or that control the nursing practice in the hospital settings. Okay, laws and regulations or legislation, that is legal standards. Nurses must adhere to follow license requirement, scope of practice, that is limitation of services according to the standing instructions. Okay, scope of practice, documentation system, and taking consent for various purpose of rendering the services. Okay, so the aspects of legal standards includes license requirement, scope of practice, documentation, and consent. First one is licensor requirement. As you know that nurses should have the license to practice in the particular state. So nurses must be properly licensed to practice and maintain their credentials or certifications. Okay. So to practice or maintain the dignity of the professions, we have to get registered in a particular state that give the license to practice, that ensure the safety of the patient. Okay, that is about a licensor requirement. All the nurses must properly licensed to practice and maintain their credentials. Then second one is scope of practice. Second element is scope of practice. Nurses must operate within the boundaries of their legal scope of practices. Okay, so nurses have to function or work according to the standing instructions as that is defined by regulatory bodies like INC, Indian Nursing Council, or state nursing councils, or even the hospital organization. They can set the boundaries or the standing instructions or legal scope of practice. Okay, so that means nurses must operate or functions or act within their limitation or boundaries of their legal scope of practice or legal standing instructions. Okay, that may be defined by, that may be set by the regulatory bodies. So the nurses must operate with the boundaries, with their limitations of their legal scope of practice, which is set by the regulatory bodies like INC or state nursing councils, or even by the hospital authority. Then third one is documentation. Of course, nurses must maintain the accurate and thorough records of all the details of the patient care of the different patients to ensure or make sure the legal compliance. Okay, anytime a legal issues can occur that may affect the patient, affect the nurses or healthcare team members, or even to the hospital. So she has to maintain accurately all the documents of the patient, the care have been rendered during the hospital stay. Thus, nurses must maintain accurate and thorough records of all the patient care to ensure the legal compliance, to solve the legal issues and problems. The last one is regarding consent. Okay, nurses are responsible to obtain the informed consent from the patient before performing any invasive procedures. Okay, so based on the policy of the hospital, okay, nurses are responsible to collect the or obtain the informed or written informed consent from the patients and the patient party before performing any procedures. Okay, these are the 4 elements under legal nursing standards. So that is about the type or categories of nursing standards. Now let's see the international and national nursing standards of practice or nursing standards. Okay, international or national nursing standards. So internationally it includes American Nurses Association ANA, ICN International Council of Nurses, and WHO World Health Organization, and nationally we have Indian Nursing Council and state nursing councils. Okay, as the nursing standards are developed by international organization and national organization, we can divide the nursing standards as international nursing standards and national nursing standards. First one is international nursing standards, in that American Nurses Association ANA standards of nursing practice or ANA nursing standards. So as the term indicates, it is developed by ANA, American Nurses Association. And now you know what is nursing standards. It is a set of guidelines designed to ensure the high quality care and professional performance by all the registered nurses. Okay, RNs. So ANA nursing standards are mainly divided into 2 main components. Okay, one is related to in relation to standards of practice, then second one is in relation to standards of professional performance. So nursing practice or nursing care, and another one is professional performance. So these are the 2 main components of the American Nurses Association nursing standards. First one is standards of practice. These nursing standards describe a competent level of nursing care or nursing services based on the critical thinking model known as the nursing process. So standard of practices according to ANA, that is based on the nursing process or nursing care plan. Okay, now you know the steps of nursing process. So that includes assessment, diagnosis, okay, outcome identification, planning, implementation, evaluations. So standards of practice according to ANA, it has got 6 standards. Standard 1 is assessment, standard 2 is diagnosis, standard 3 is outcome identification, that is objectives, standard 4 is planning, standard 5 is implementation, and the 6th one is or 6 is evaluations. The standard of practice describe a competent level of nursing care or nursing practice or nursing care practice that is based on the critical thinking model that is known as nursing process. Second one is standard of professional performance. These standards describe or explain about the competent level, okay, maximum level, highest level of behavioral, okay, personality of the nurses in the professional role. Okay, these standards describe the competent level of behavior of the professional nurses or in professional role. It includes 10 standards. Okay, standard 1 is ethics, okay, following ethical principles. Second one is standard second is education, higher education. Okay, third one is standard 3 is evidence based practice and research. Standard 4 is quality of practice, quality assurance. Standard 5 is communication. Standard 6 is leadership. Okay, taking responsibility and accountability, leadership. Then standard 7th one is collaboration, participation with various other sectors or organizations to render the comprehensive patient care and uphold the professional standards and performance. Then standard 8th one is professional practice evaluation. Professional practice evaluation. Standard 9th is resources utilization. Okay. Well utilization of the available resources, man, money, material. And standard 10 is environmental health, protection of the environment. So these are the two components of the ANA, American Nurses Association International Nursing Standards. First one is standards of practice and second one is standards of professional performance. Standard of practice includes 6 standards based on the nursing process. Standards of professional performance include 10 standards. Okay. The second international organization, that is World Health Organization guidelines. The World Health Organization sets international standards and guidelines that influence the nursing care all over the world. Okay, especially in the areas such as patient safety, infection control, and public health initiatives and programs, IEC programs. Okay, public health initiatives or programs. So WHO sets international standards. Okay, universal standards and various guidelines. Okay, that influence or that enhance the nursing care throughout the world, especially in the area. The area mentioned is here patient safety. Okay, that's an important area. Then infection control in the hospital settings, infection control and public health initiatives for the public health and community, public health initiatives and programs, awareness programs. Then third one is according to International Council of Nurses, ICN's Code of Ethics. I have already uploaded a video about the Code of Ethics. If you would like to see about that, you can watch in the YouTube. That is Code of Ethics. Okay. So International Council of Nurses developed a Code of Ethics for the nurses. The ICN provides ethical guidelines. Okay. That set the foundation for nursing behavior globally. Okay. That is focusing on the responsibility of the nurses towards the patients, towards the families, towards the colleagues, healthcare team members, and with the society or towards the society. Okay. Thus, ICN provides ethical guidelines with the set ethical principles. Okay. That set the foundation for the nursing behavior of the nurses. Okay. Universally or globally, which focus on the responsibility of the nurses towards patients, families, colleagues, and with the society. Then second type is National Nursing Standards. That means according to Indian Nursing Councils, INC. The Indian Nursing Council, the regulatory body responsible for establishing and maintaining the standards for nursing education and practice in India. Okay. In India, it is controlled by Indian Nursing Council. Okay. So it is a regulatory body which is responsible for establishing, developing and maintaining continuing standards for both nursing education, quality education and quality healthcare practice in India, which develop a set of standards of nursing practices. All the Indian nurses has to follow or abide the Indian Nursing Council's nursing standards. The key components of nursing standards by Indian Nursing Council. Okay, INC. So there are 6 key components. Okay, of the nursing standards of Indian Nursing Council. First one is standards for nursing education. So quality education. Okay. Then standards for clinical practice. That is performance in the hospital settings. Then standards for professional practices, professionalism. Then fourth standards related to legal and regulatory compliance. Okay. So compliance with or following with the legal responsibilities, legal and regulatory rules and regulation compliances. Then fifth one is standards for specialized nursing areas or special nursing departments. Okay, standard for specialized nursing areas. The last one is infection control and patient safety standards. Sixth one is infection control and patient safety standards. So these are the 6 components of nursing standards by Indian Nursing Councils related to education, clinical practice, professional practice or professionalism, legal and regulatory practices, then standards in specialized nursing areas, then infection control and patient safety. Then second national agency, that is nursing standards of state nursing councils. So all the states have been formed their own nursing standards to render the services in their own state. State nursing councils in India play a key role, an important role in regulating the nursing profession at the state level. Okay. INC maintained at the national level, but state nursing councils that regulate at the state level, and ensuring that nurses follow the professional and clinical standards to uphold the profession and nursing services. While the Indian Nursing Council set the national framework for nursing education and clinical practice, State Nursing Council implement that what is developed by the Indian Nursing Councils, and of course enforce these guidelines within their respective states. And at the same time, each nursing council enforce these guidelines, INC guidelines within their respective states to follow by the nurses in their own state. Okay. Then moreover, state nursing council also adapt the standards according to the need and the problems of the particular state. The problem will be vary from state to state. The state nursing council itself or also adapt the various nursing standards as needed based on the local healthcare needs, public needs and the local condition of that particular state. The summary of the typical nursing standards of State Nursing Council in India are: one is registration and licensing standards. Standards related to registration after the degree programs, nursing programs and licensing. Okay, giving license to the institution and to the individual to practice in the state as the registered nurse. Then standards for nursing education, setting standards for nursing education to promote or enhance the quality. Then standards for clinical practice in the clinical area, standards for professional conduct or behavior. Then infection control and patient safety, nursing standards of infection control and patient safety. Then standards for specialized areas of nursing. Okay, same thing what we have discussed. Then collaboration with the Indian nursing councils, cooperation and coordination and collaboration to render the or maintaining the nursing standards with the INC, that is Indian Nursing Council. Then quality assurance in nursing practice or in the hospital settings. Okay, excellence in rendering nursing services. Then ninth one is standards for community health nursing and public health nursing in the community setting. Okay, with various public health initiatives and programs. And last 10th one is 10th standard is legal and regulatory compliance with the legal and various rules and regulations of the statutory bodies and regulatory bodies or other professional organizations. So these are the summary of the typical nursing standards of the State Nursing Council in India. Now let us talk about the importance of nursing standards or advantages of the nursing standards. Now you know everything about the nursing standards. Now you can make your own point of view about the importance or advantages of the nursing standards. So first one is maintaining quality assurance. Okay, quality assurance. Second one is of course patient safety. And third one is professional accountability and responsibility. Okay, nursing standards make professional accountability in each staff and responsibility. So they are answerable to their services. Then legal protection for the patient, nurses and hospital authority. So legal protection. Okay. Then guidance for practice, evidence-based practice, maintaining and upholding the nursing standards and professional standards. The guidance. So of course nursing standards provide the guidance for practice for the professional nurses. Then of course professional development. Okay. Continuing education. So to get the maximum advanced knowledge in the area of the patient services and patient treatment, that includes skill, competency and attitude. Positive attitude in rendering the services. So these are the 6 important advantages or importance of nursing standards. Now let us see what are the disadvantages or challenges of nursing standards in India. First one is rigidity and lack of flexibility. So it is a predetermined established standards. We cannot change that. Okay, so that is very rigid. Okay, it is not flexible. We cannot make changes that standards. It is already set by the healthcare agency or accreditation agency, etc. Okay, that is first one is rigidity and lack of flexibility. Then increased workload and documentation. Because of these nursing standards, everything is evaluated through the records. Okay, standards is enhanced through the proper maintenance of the records. That increase the workload of the nurses in the nursing stations and hospital. That is increased workload and documentation. Increased the number of documentation with the different records. Then resistance to innovations. Some of the nurses, they are basically resistant. Okay, to adapt the innovations or application of evidence-based practice. So resistance from the part of the nurses to innovation or changing. Then fourth one is cost of compliance and training. Of course, to maintain the standards, the nurses should give one special training. Okay, manpower development and training. Okay, for that the hospital agency required additional expenditure. So that is a cost of compliance and training or cost for compliance maintaining the standards, international and national standards of nursing practice. Okay, that is regarding cost. Okay, expenditure. Then fifth one is varied interpretations. Though the nursing standards are predetermined, okay, but different people will make a different interpretation of the standards, okay. That is, the interpretation of the standards are vary from people to people and place to place. Then like that, there are many other disadvantages or challenges in achieving the nursing standards in India. So far we have discussed in detail about the nursing standards or setting of nursing standard practices in India. Hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel. And stay tuned with the Angel Health Academy for the next and important academic video. Please don't forget to convey your gratitude or regards in the comment box. Once again, thank you so much for watching my video. See you and take care.